A great beginning to our day here, day 3 at the Vizient Connections Summit with our podcast. I am joined by my good friends at Draeger up here, and we are going to be talking about a healthier bottom line, balancing quality care, collaboration, and cost in hospitals and IDNs. And to talk about that, my two distinguished guests, and I will call you distinguished because once I read your bios, you'll see why. This is Georgia Casciato, a healthcare leader and with more than 35 years of experience. She's held senior roles with health systems and global think tanks, and now leads her own consulting firm, helping organizations bring innovative solutions to market. Georgia is widely recognized for her expertise in strategy and partnership, and for her ability to foster collaboration across the industry. Georgia, thanks for being here.
Thank you so much, Tommy. It's a pleasure.
You're welcome. And joining Georgia is Larissa Kraus. She's the Vice President of Strategic Corporate Accounts for Draeger and has over 25 years of experience supporting customers in the healthcare industry. Welcome.
Thank you.
Between you two ladies, 25 years, 35 years, you got a lot of years in the healthcare business.
We certainly have invested in the industry as the industry has invested in us.
There you go. Larissa, can you give me a little insight of just what Draeger does?
Sure, absolutely.
Yeah.
So Draeger is a over 100-year-old company.
Oh, wow.
Based in Lübeck, Germany. In the U.S., we're in Telford, Pennsylvania. And we are focused on critical care devices for hospitals. And so that's encompassing both services, clinical solutions, as well as the equipment.
When we talk about delivering healthier bottom lines, it starts with patient outcomes. Everything's about patients. We all know that. That's why we're all in this business ultimately. How are hospitals striving to improve patient care despite today's many pressures?
Patient outcomes, bottom line. That's why we do what we do.
100%.
Again, who wants to have their appendix taken out by the lowest bidder if there is no quality? And there are now, again, if there is quality and the metrics are there and survival rates are there and everything else, yes, but just using cost as its only metric is just one variable. It will become more difficult. There are so many things that are changing industry-wide, and we're all very much keenly aware about the reimbursement changes. But so what is this going to force health systems to think about differently?
Yeah.
It's going to think about planning as a system. It's going to be thinking about the business operations that you need to have in place to support that care. So that would be strategic alignment. That would be planning across the system. That would be the resource allocation. That would be going to the point I just made, bringing in best partners that perhaps can augment what you might have had to cut as a health system. Evidence-based practices, research, clinical teams, development. So the true north never changes. How we get there is what's going to change and is that hyper-focus. If I could kind of close that question with one comment. I'm from Chicago.
Yeah.
I've done quite a bit of work with all kinds of health systems, including a safety net hospital on the west side of Chicago. In that role, I have seen someone who has had, same person, a CEO role, COO role, CMO role, and CIO role. And on their desk is a plaque that says, how does this serve the patient?
Yeah.
So unless we can't pull all of that together, that's what we're focused on helping our clients with.
Yeah, fantastic. Larissa, can you expand upon that? Have you seen an example of that?
Yeah, absolutely. So one of the examples that I would provide is from University Health in Kansas City.
Okay.
They had a NICU level 3 that was built in 1979. And today they were delivering over half of the babies born in Kansas City. So they were not being able to keep up with that.
Wow.
Type of deliveries. Yeah. So we partnered with them. They were looking to redesign their NICU to look at neuroprotection, really focusing on the family and the babies and those needs. And they were looking for a single vendor to help pull that together so that it would streamline workflows for their staff, just be a better overall experience for the families. And so we worked with them from the ground up and helped build that workflow, better design, and improve training and just really the kind of their overall day-to-day care for the babies.
Georgia, what role do data analytics and AI play in helping hospitals reduce inefficiencies and improve outcomes? For example, shortening length of stay or preventing readmissions. And I mean, I know AI is such a buzzword. It's such a new thing, so exciting. but also can be kind of scary at the same time. So how does that work in?
Well, it's really important to recognize that these are very valuable tools.
Yes.
And by very valuable tools, again, you need to think about it. It needs to be a tactic in support of a strategy. And, from that perspective, how can it be used in terms of raising the bar for evidence-based care, for real-time information? Again, it isn't, and you're right, absolutely right, Tommy, it is very much a buzzword in the industry, but really thinking very strategically about how to align it with work teams, how to train, how to use it to augment great systems and processes that need to be in place. But you're absolutely right. There are areas where it can certainly impact length of stay, readmissions, and in some cases, even predictive analytics to what's your flow going to be in the emergency department? How do we staff for it? But, all of these kinds of tools go back to the question I just answered about what are the business processes that we can use to do things better. And one area that we haven't really touched on yet, but is standardization.
Okay.
That as you have a lot of hospitals that are merging and expanding, you're going to have more opportunities for variation that you need to bring into some level of standardization, which reduces redundancies, makes training easier to work across lines. And again, making sure that you're working with partners. Notice I'm very intentional saying partners, not vendors.
Yes, partners.
Who support that.
Yeah.
And Larissa, I know that you have an example to share with us in that space.
Actually, I have a couple, and I think I'll just kind of share that along with the journey for Draeger, because we have been very dedicated to the data and using the analytics to help hospitals improve their outcomes. So the first one I'll use is Avera Heart Hospital in Sioux Falls, South Dakota.
Okay.
They're our partner with patient monitoring. And back in 2016, ECRI came out with an alert on a health hazard of alarms, patient alarms, and it became a national patient safety goal. And so we sat down with them together and looked at the data and came up with a baseline that they had over 71 alarms per patient that the nurses were dealing with. And so their goal was to obviously reduce that.
Yeah, that's a lot.
The fatigue, have the nurses more focused on actionable alarms. So we worked with them on that, and we reduced that by 30% just in one of the units there. So that was, one great example from almost 10 years ago.
Yeah. Yeah.
And fast forward to today, where we've just launched something around jaundice management. We know that a lot of babies go home and then their jaundice spikes, their bilirubin spikes, and then they have jaundice issues after they're discharged. So then there's readmissions potentially from that. So we have this product now that we just launched called Billy Predicts. And that is a software designed where it can predict within 60 hours whether the baby is going to have jaundice or not.
Oh, wow.
And so you can actually treat that before the patient goes home.
That's fascinating.
Really dedicated to helping improve outcomes for the hospitals.
What strategies have you seen that effectively support staff well-being and help hospitals retain top talent? Because it's such it's an expensive undertaking as well when you got a turnover all the time. I know how that works. So what have you seen, Georgia?
So again, we're critically aware of nursing shortage. We're critically also aware of physician shortages. And also recognizing that, it really all came under the microscope with COVID and it's not fully rebounded. The other thing that we've seen are a lot of physicians who might have retired in specialties that you're not seeing the same number of doctors coming out of schools. So that also does trickle down. That trickles down into all levels of an organization.
Right.
And so some of what the more progressive strategies are doing is really doing some, first of all, critical focus on job enrichment and job development and job support where they can. From that perspective, clinical education, training, and development is a way, again, to recognize employees who are doing well, that the organization sees the opportunity for them to advance and they're investing in them. And again, that's a place where if you're working with a health system who has made cuts, that's also a place where a partner organization like Draeger can provide that information. The other thing that I've seen a lot of leading organizations do that I think is really, really important is it's very easy to keep the highest level priorities, the key performance indicators in the boardroom, in the highest level of the organization.
Yes.
And not transcending down. I mean, the key focus areas are always going to be in areas of patient outcomes, patient-centric care, affordability, accessibility, how are we impacting community health? That is such a powerful mission and vision to share, that transcending that down to all different levels of an organization and reminding people about, first of all, the organization's personal why, of why do we do what we do, but translating that down to a level of the frontline employee of why is it so valuable that you're here to support the mission, connecting the dots, creating more team synergy. And again, these are things that are very easy to go by the wayside.
Right.
Finances are tight, but this is the part of the value proposition that you have to invest in.
Yes.
Because these are the people who are going to take care of the patients on the way in and the way out.
Yeah.
And I might add that, the shortage that we're seeing, not just with nursing, also impacts biomedical engineers. So the people who are repairing the equipment, there's a lot retiring and there's not enough coming through to actually be hired and service that. So with our education side, we really kind of looked at that to revamp that, because we knew people didn't have enough time to, send their staff to the hands-on time that might be needed. Mm-hmm. So we started doing e-learning ahead of time and sending that ahead, so it would reduce the amount of time that we were on site and they had to dedicate to, the hands-on learning. We've also incorporated virtual reality and using that to train the nurses so that they can interact with the equipment and patient while they're learning as well. So we've redone that, and we've done that. We started that in a large health system in Texas, and the reception has been overwhelmingly positive. Really good.
Very cool. Very cool. Even as hospitals and staff put patient first, we know that's a big thing. Financial responsibility can't be ignored. I mean, everybody has a bottom line, right? The financials. How have you seen hospitals balancing cost pressures while keeping the focus on quality care?
Well, there is an expression in healthcare of no margin, no mission.
Okay.
So again, the finances are a reality. The reimbursement changes upcoming are a reality. But what is also the North Star in the reality is best outcome for patient care.
Yes.
So what it really becomes is more of a challenge of how do we think and strategize and plan differently. I mean, some examples I've seen in my own Chicago market are large health systems that don't offer every service at every hospital. There might be a cardiovascular institute at one of the hospitals where that, again, they'll triage and they'll send, cases to a specific place, or an orthopedic hospital, but is really taking that innovation look about not how have we always done it, which it goes to the silos you were talking about, Tommy, but how could we do it? What can we learn from other industries, best practices from other industries? What can we take as best practices in our own industries? And how can we access? I know that they say anytime anyone comes to a conference, you should look to leave with at least one new idea to try. And again, if you're working with the right partners, they should be very rich of those kinds of ideas and strategies of what worked somewhere else, what didn't work somewhere else, but helping you think differently. And again, the other thing you're seeing a lot in healthcare is the bringing in the very rich patient and family stories to help inform people and remind people of the why, because that in itself might forge some interesting thinking.
Mm-hmm. Keep thinking outside the box, keep figuring out how to solve the problems. Larissa, do you have any examples?
Yeah, I think that's a great segue into an example of at Florida Hospital for Children, which is Advent Health. It was also a NICU that they wanted to redesign. The nurses needed better access to the patients, but they really wanted to focus on family-centered care and improving that family bonding time. So we worked with them to redesign the entire NICU, and the end result is they tracked that. They tracked their patient satisfaction scores, and their satisfaction scores went up 5% just from that redesign.
That's big.
So it was a significant impact for their outcomes. Yes.
Yeah. Ladies, thank you so much for joining us up here today. It's just been a great conversation. And I know you said it earlier, but it really just all comes down at the end of the day to patient care, taking care of our patients, doing the right thing, whether it's just sustainability or just thinking outside the box and how we can improve processes. It's really amazing. You guys are doing a great job. But thank you so much for joining us today.
Thank you, Tom.
Thank you, Tom.
Yeah. Enjoy the rest of your summit.
Thank you.
You're welcome.
Thank you.